Hello, my name is Sarah Foster, and I am a provisional licensed professional counselor and a doctoral candidate for public administration. In my presentation, we'll discuss the mental health effects of maternal substance abuse policymaking. This research is based on my ongoing dissertation. So let's get into it. Before we officially get started, I would like to give you a brief overview of what we will cover in today's presentation. First, we will discuss the problem statement and a review of the literature. In the literature review portion, we will explore the research questions and impacts on laws and behaviors in Georgia, Tennessee, and Louisiana. Then we will talk about the theoretical framework, maternal substance abuse policies, and methods. Lastly, we will conclude the presentation with some insightful facts. So let's explore what maternal substance abuse means. According to Foray 2016, maternal substance abuse is defined as a serious public health issue that has been related to several negative maternal and fetal outcomes. Implementing strict laws can have both a negative and positive impact because they can influence outcomes. According to a 2015 study that you see here in this slide, laws can encourage maternal substance abusers to hide their addiction instead of seeking assistance due to stigma and lack of motivation. So I just want to point out in the slide that 73.3% of maternal substance abusers do not feel motivated, whereas 26.7% did not possess the same feelings. This slide entails an overview of the research questions for this study. And so those questions are as follows. The first research question: are strict maternal substance abuse laws more effective in addressing consequences and behavior changes? 2, how can accountability be addressed in maternal substance abusers through the law? And the final question: how do substance abuse laws impact the behaviors of maternal substance abusers? While each state has its own varying approach to maternal substance abuse, this analysis focused primarily on the laws of Tennessee, Louisiana, and Georgia. Now, in 2014, Tennessee was the first state to pass a law criminalizing maternal drug and alcohol abuse. This particular law was referred to as the fetal assault law. The fetal assault law was stringent and it had detrimental effects until it expired in 2016. In Louisiana, pregnant women who abuse substances face child abuse charges, which can lead to termination of parental rights. Georgia, in the alternative, does not criminalize the way that the previous states do. The state prioritizes substance abuse treatment by giving pregnant abusers premier selection for inpatient and outpatient programs, mainly inpatient programs, because outpatient programs, we mainly see this in aftercare. They do also have very involved child welfare policy that addresses these needs. Laws like the one in Tennessee and Louisiana act as deterrents to expectant mothers seeking treatment for fear of being prosecuted. While Georgia's law does not prosecute, the invasive child welfare policies also deter these parents from seeking treatment for their addictions. I reference Maslow's theory of motivation here because psychological safety has been proven to be a key indicator of change. According to Maslow's hierarchy of needs, also referenced here, when an individual needs are met, they are motivated to adapt to positive behavior. Without these safety protections in place, these policies do not curb their abuse. So in this particular slide, I would give you an overview of what each policy entails as far as it relates to state level maternal substance abuse policies. First, we have mandatory warning signs. Mandatory warning signs are linked to the risk of maternal substance abuse. It determines who oversees posting and where they should do so. For priority treatment, specific conditions might gain mandatory priority for treatment over others. Such conditions might include maternal substance abusers or postpartum abusers. Prohibitions against criminal prosecution restricts the use of any test that can serve as proof for criminalization. And then we have the reporting requirements. Reporting requirements, this basically has to do with mandated reporters. Just to give you a breakdown of who a mandated reporter would be, that would be doctors, counselors, nurses, even teachers, and many, many more examples other than these. The reporting requirements are mandatory when there is a suspicion of mistreatment. Child neglect and abuse. Child neglect and abuse, we've talked about briefly when we were talking about the state of Louisiana. With this particular behavior, this is a behavior that causes physical or emotional harm. And finally, we have civil commitment, which is involuntary required treatment. For this particular study, I employ a mixed method approach. I use data from the National Survey on Drug Use and Health, particularly the 2018 one. In short, this study is sometimes referred to as the NSDUH database that determines how drug and alcohol abuse has affected pregnant women. Qualitatively, I have conducted a series of 9 to 12 semi-structured interviews with mental health and substance abuse professionals in Tennessee, Louisiana, and Georgia to how current policies for neonatal substance abuse deter users from seeking treatment. Here we have a list of treatment options. It's important to know about this for aftercare. So after most ladies or this population goes to inpatient, they need a form of aftercare so that they know they have a resource after they come out of inpatient. One of the main things here is parenting classes and support services. Although both 12-step programs and self-care groups serve as support services, they are each unique. 12-step programs are spiritual platforms where individuals are encouraged to help each other remain or become drug and alcohol free. Self-care groups include individuals who have the same issues and share their experiences to help support each other. And then third, we have the intensive outpatient programs, also referred to as IOP programs. This includes individuals who mainly have co-occurring disorders and need rigorous treatment. Lastly, we have the inpatient programs. The inpatient programs are the most intensive of the programs and involve around-the-clock care to keep patients safe. In conclusion, maternal drug abuse will not change until the necessary measures are taken to address the issue. I am expecting my results to reveal that more maternal drug abuse goes underreported in these states due to their policies. I expect my implications to be that aftercare treatments such as 12-step programs and intensive outpatient programs such as IOP or even inpatient will play a vital role in maternal substance abuse enhancement and accountability. Here's a limited list of references used for today's presentation. Thanks for listening. And if you have any questions or feedback, please connect with me at my LinkedIn account or at my email address at sf919434@wcupa.edu. Thank you.